Hello, my name is Jenifer Satya Shapiro. People call me Satya, and I'm an integrative medicine practitioner in Santa Cruz, California. I'm trained in a variety of alternative methods, and you can see my website at jensatya.com for more on me and my background and the methods that I offer. What I'm going to talk about today is alternative treatment options for the treatment of things like depression, anxiety, and even PTSD. I hope this video is useful for you, and feel free to comment or contact me at any point in time for more information. Thank you for listening. One thing that's been amazing to me over the past 20 plus years that I've been in practice is that most people don't know there are alternative options for the treatment of depression, anxiety, and even PTSD. I'm going to offer a few ideas here of how someone like myself, who's an integrative medicine practitioner practicing homeopathy, herbal medicine, nutritional medicine, and a variety of mind-body techniques, can offer new options for someone seeking something other than standard medicine. One of the reasons that I created this audio/video is to provide those who are too sensitive to standard medicine with other options so that they can start to research and find things that work for them. As someone who also works a lot with sensitive clients, people sensitive to chemicals or sensitive to EMF or sensitive emotionally, I find that we need to understand all of our options so that we can find things that work specifically for us. And in a world that is really owned by some of the larger corporations, pharmaceuticals, and things of that nature who market themselves very well, often we're not given the other information to know our options. So today I'm going to talk specifically about homeopathic medicine, herbal medicine, and supplemental medicine for providing alternatives for depression, anxiety, and PTSD. I'm specifically talking about those three things as they are what I treat most often. Not that these forms of medicine can't be helpful for other psychiatric disorders as well. And please see my disclaimer below as well, because the FDA requires that anyone in alternative medicine state they are not a standard medicine practitioner, they are not a standard medical doctor, and this audio/video is for information, not advice. Thank you so much. So in another video, I'm going to address more on the somatic and mind-body techniques that are used to treat these challenges, and all of those techniques can also be integrated into healing the brain and the emotions. Homeopathic medicine, which is a passion of mine and something that I practice every day, is a form of medicine that's very misunderstood in the U.S. Luckily, I was trained by people who were mostly European teachers, and most of my teachers, homeopathic medicine is part of their culture. So I learned very quickly to see things a different way. And so I'm going to offer you a different way of looking at healing with homeopathic medicine. Homeopathy is useful for many things, but in the realm of psychiatry, it's most useful for three things. First, for bringing the body back to balance after something external or internal changed how it responds to stress. So for instance, if someone has had a major trauma, their vital force may always be in a heightened state. And that can cause anxiety that's chronic, and which can also lead into PTSD, because often what most of us have learned over the years is that PTSD is often not on its own. PTSD is usually combined with anxiety and or depression. So if the vital force has forgotten how to work naturally, how to work in a way that doesn't have these constrictions, then someone's system can always be in a state of stress, and that may cause them to be reactive to their external environment, not responsive. Another way to look at this is if someone has had an internal change, such as cancer. When someone has something like cancer or an autoimmune disease where their body feels so different, they feel so unlike themselves for such an extended period of time when they need to heal. Lyme disease does this as well. That can cause an internalized trauma. That can cause someone to feel so separate from themselves that they no longer trust their body. And when they no longer trust their body, there can be some dissociation And there can also be some stuck emotions. And that whole combination can create a level of PTSD for some clients and or anxiety or depression. And all of these states can cause an individual to feel like they haven't been like themselves since before the illness. Homeopathy does not see the emotions as separate from the physical body. So when we offer homeopathic medicine to release these constrictions in the vital force, to help the body remind itself how to balance after all of this vital force confusion, homeopathy looks at the entire system. Meaning when I give someone a homeopathic, the homeopathic medicine will help the emotions as well as the body. It'll help the brain, the nervous system, and the body heal and come to balance. So that is one way that homeopathy is used to assist someone with these psychiatric issues. A second area that homeopathy works with is reconstructing the vital force when it's been broken or depleted for a period of time. I'm going to go back to, say, something like chronic illness like Lyme disease, or even something like Hashimoto's, which is a thyroid disease that is an autoimmune disease when someone is hypothyroid. Something like Hashimoto's or Graves' disease when another autoimmune disease, but it's when someone is hyperthyroid. All of these forms of chronic illness can cause the vital force to break down and become depleted. And it can feel like that person never has enough energy. Like no matter what they do, no matter what they take, no matter how much they exercise or how much they sleep, they can never get back to their normal flow. When the system has been depleted this much and it can't remember how to get back to itself, homeopathic medicine can be used to rebuild the vital force energy and help the individual come back gently and effectively to a state of balance. Again, I like that word balance because for me, homeopathic medicine is all about balancing the vital force. Once the vital force is back, the individual will then have the strength to deal with the emotions in a healthier way. And that's one of the main challenges that I see when we start treating PTSD especially, is that we keep trying to treat someone who's so out of balance that giving them a drug that makes them feel even more unlike themselves is making the situation worse for a lot of people. And so what homeopathic medicine can do is bring you back to yourself first, bring your energy back, so then the individual will have the strength to deal with the emotions in a healthier way. Now, the third area that homeopathy works with trauma is an area that I consider more how the trauma is held within the body and mind. With many of my clients who are dealing not only with depression or anxiety, but also PTSD, we're seeing that the nervous system and the brain have gotten stuck in some ways. They are in a reactive mode almost at all times. They react to situations in dramatic ways that in the past they may have responded but not reacted. What I mean by that is if someone is always in a heightened state of alert, they're going to be reacting to their environment. And they're probably not going to be able to sleep well. They may lash out in situations that don't call for it, things of that nature. Or they may just feel like they're constantly internally in that state of alert, and they're afraid that they won't have control over it when they actually do. It's just not a fun way to live. And so what homeopathic medicine can do is start to clear the trauma out of the nervous system. And I have to say, being a homeopath for as long as I've been, this is still so magical to me when I see this happen, where the nervous system can actually release all of that energy and they can come back into themselves. And they'll tell me after taking the remedy, I felt like I came back into myself. I no longer have that constant state of anxiety just from taking a homeopathic. And homeopathic medicine can gently clear these patterns. If it's given properly. Now, I've also seen people take way too much of a remedy at once, and that will at times exacerbate the problem. So you need to make sure that you honor the remedies and work with a homeopath that knows how to deal with someone who's in these states, because they're more sensitive often than people who are not in these states. And just think of it this way for a moment. When our nervous system is constantly on alert, we're in a heightened state. It's like having way too much caffeine in the body. And if I give you something that's too strong, it can intensify the situation before it releases it. The The homeopathic will still usually release it. It just won't be a comfortable way to do it. And my goal is never cause harm. So when I treat someone, I'm very conscious of how their energy is so that I'm treating them accordingly. Now again, when we release that tension, we'll call it tension from the nervous system and the brain, so they're no longer in a reactive mode, we again give the individual stability to be able to deal with the emotions and the memories. It's always amazing to me that we expect people with PTSD to just start talking about the trauma. If someone's in a reactive state all the time, that doesn't feel safe. We need to learn how to reduce that anxiety state so that they can talk from a place that's more reflective for them to heal, or we're just going to keep re-traumatizing them. So I believe homeopathic medicine can be a wonderful tool for standard therapists. I actually trained standard therapists for years and will continue to do so to help them use homeopathy, homeopathic medicine, with their clients so that they can help their clients get to a more balanced state and then talk about the challenges. So that's how homeopathic medicine can help. Now I'm going to talk a little bit about herbal medicine. Herbal medicine I often use along with homeopathic medicine because I am a homeopath, as well as an herbalist. So herbal medicine can be useful in treating emotions and the mind as well. And I find two ways that I use it most often. Not that I don't use it for other reasons as well. These are the most common ways that I use it for psychiatric issues. First, I use it to help rebuild one's internal energy resources, especially while I'm treating them homeopathically, because homeopathic medicine, while it will rebuild internal energy, it may take a couple weeks. It may take 2 to 3 weeks to really get someone back if they've been chronically ill for a long period of time. So someone who comes to me after 10 years of being in the state of depletion, treating them homeopathically is going to take some time to clear that. So along with homeopathic medicine, I may give someone some herbs to bring their vital force to a balanced state while I'm treating them homeopathically. Now, one big difference between homeopathic medicine and herbal medicine is I find that homeopathic medicine, you don't have to give them many doses for the vital force to learn, usually, depending on the issue. So it may be that they're taking the remedy for a couple weeks or a few months tops, and then their system will learn how to do what it needs to, and you don't need the homeopathic anymore. With herbal medicine, I find it takes much longer. I often have to treat much longer because herbal medicine is more like a supplement. So just to note that if you're looking at something that's more cost effective, I personally find herbal medicine, while not expensive by any means, is a little more expensive than if I treat someone just homeopathically. So I do lay out all the options for my clients so that they're aware of what my expectations are and what they're going to need and what their options are. And depending on their financial situation, I try to be very sensitive to that and give them the options that will give them the biggest improvement and the safest way, and also be the most cost effective for them. So that's one way that I use herbal medicine, is to rebuild internal energy while I'm treating homeopathically. A second way that I use herbal medicine that's very effective is to balance anxiety and deal with stress. And this can also greatly improve sleep. Certain herbs in Western and Chinese medicine that I work with balance the nervous system and help the brain deal with stress to calm our reactivity and give us the strength to choose our emotional state. You're seeing a pattern with me now. I like to calm things before I start talking about traumas. So helping the brain deal with the stress, we again bring the body to a calmer emotional state that's not reactive, and we can become responsive. Again, reactive versus responsive. We want responsive so we can choose our response, not react to our environment. And so when we get them to that state with herbal medicine or homeopathic medicine, then once we're feeling better, we can then use other techniques to heal the underlying memories and events that cause the trauma. So I hope that makes sense to you as far as herbal medicine. Herbal medicine and homeopathic medicine I can use interchangeably in some respects, and at the same time I almost always with these cases use homeopathic medicine, and I sometimes use herbal medicine too. So our third way of dealing with these psychiatric challenges, like homeopathic medicine and herbal medicine, supplements, vitamins, minerals, can also be useful in healing the mind and emotions. The main way that I use supplements is to help the body to heal and not be so depleted after loss or trauma. Also, what I find is many of the clients who come to me with chronic PTSD are not necessarily eating well. And so they can be depleted in things like vitamin D or iron, depending on what they're eating. If they're vegan, I often find depletion of B12, zinc. If they're having thyroid issues, they may be low in selenium or different things. So I do look at the body when we're healing the mind. Once again, they're interconnected in my opinion. So what I'm looking at with supplements is, do we need to help the body be more healthy? And I may offer a protein shake or certain vitamins or supplements to help rebuild the body and help them take better care of themselves, because when we're taking care of ourselves, we're also helping the mind and emotions. So taking better care of ourselves is sometimes it's useful to use supplements. And while blood tests can be useful just as an offshoot of something that I also offer certain intuitive checks and meridian line checks and applied kinesiology when appropriate to the client. So there's a variety of ways that we can back up the need for any different supplements. I hope this was useful in considering other options in psychiatric medicine and looking at things a little bit differently when we're looking at healing the mind and emotions. And I hope this was empowering. Feel free to reach out, ask any questions, or see my new website for more information at jensatya.com. I also have livingsensitive.com and a myriad of other websites with more information. And please look for upcoming videos on somatic healing and mind-body healing for PTSD, depression, and anxiety. I hope you have a blessed day filled with good health. Blessings.